Thanks for coming on short notice. Obviously, with the national news, we felt like it was important to update y'all, so y'all can update your viewers and readers. Not only what's happening here at the medical center in preparation for COVID-19, but also we're going to share some information that we think is very helpful and it should be. The public should know about how to lessen their chances, right? So we've got a good high-hitting team today. Dr. Paul Byers, state epidemiologist, which many of you know, is with us today. He's going to talk a little while about the coordinated state plan and what's happening there. Jason Smith with UMC Emergency Services will be here to answer any questions that may have to do with those types of coordinated activities. Dr. Jason Parham is going to speak first. He's an executive vice chair of the Department of Medicine, but he's the director of the Division of Infectious Diseases. So he's going to start us off here in a minute. Dr. Bagi Navakali, she'll say it better than I will. Assistant Professor of Infectious Disease. She's also the medical director of our Office of Infection Prevention, which has a lot to do with how we're being prepared here internally, and then Sheila Fletcher, who's our Director of Infection Prevention. So, Dr. Jason Parham is going to kick us off. Peter, thanks.
Hi.
Turn that on.
Great. I think it would be, it's important for me to bring up what I think are important things for Mississippians to think about right now as we have a time of focused anxiety and possible tension, maybe even a little bit alarm with the current situation with spreading coronavirus across the world. This is an opportunity for us as physicians, and certainly an opportunity I'd like to take to explain that while we don't currently have active spread here in the state, and while we don't currently have active spread in the U.S., we do need to realize that there are other respiratory illnesses that we are dealing with day to day, and that has not changed. The common sense things that we do for those illnesses apply to this situation as well. And that includes that when you have a respiratory illness or when you're sick, when you're running a fever, you have a cough, you're sneezing, runny nose, you need to think about removing yourself from other people who could potentially contract the illness that you're carrying. You need to make sure that you're washing your hands appropriately, either with soap and water for at least 20 seconds or using alcohol-based foam hand cleaner to where or a gel hand cleaner to where you are removing the germs from your hands and trying to prevent other folks from catching the illness. You also want to practice cough etiquette, which is making sure that you use a tissue and then throw that tissue away into the trash can, and then perform hand hygiene, or if you don't have a tissue, to cough into the corner of the crook of your elbow to try to prevent from spreading those germs. We need to think about that for all kinds of respiratory illnesses, other viruses that we have, not just this novel coronavirus, but also things like influenza, other things that can cause viral respiratory tract infections. We need to be thinking about all of those things at this time. I'd like to introduce Dr. Bagi Navakeli, who's our Medical Director for Infection Prevention, to talk a little bit about the ways that university is specifically preparing for this situation. Bagi.
Thank you. So in regards to the coronavirus being there in US and spreading across in other parts of the world, UMMC has been preparing, actively engaged with health department, emergency preparedness, infection prevention, and other departments, so that if we receive a case who's suspected or confirmed to have the COVID-19, we would take appropriate measures. So some of the steps we have done, this is in coordination with health department as well. We have implemented some screening tools for catching any patient who might be coming in the inpatient side, like through the emergency department, or in a clinic as well. So the patient who's arriving would be asked specific questions if they have had any travel outside of United States in the past 30 days, and if it does include travel to China, and the patient has signs and symptoms suggestive of this respiratory infection caused by the COVID-19 disease, they would be immediately placed under isolation. We have been giving out education to our staff as well regarding the identification as well as isolation process, and we are also educating our staff on how to appropriately wear personal protective equipment if they are assigned this case to be taken care of. We have also been educating our other physician providers as well, and we have in place a workflow so that any suspected case would be safely and with least possible exposure be transferred to a private room. This is usually a negative pressure isolation room where the patient is placed in, and the patient, any healthcare worker who enters the room requires to wear personal protective equipment such as gown, gloves, as well as a special mask which is called N95 to protect themselves from catching the virus. I can turn over to Jason Smith and Sheila Fletcher so that they can give more information regarding the screening tool as well as the personal protective equipment.
Can I just ask one question about the emergency room? When you say that, you know, of course, they will be taken and I guess they're in a triage kind of thing and asked if they've traveled out of the country or whatever, but we know what the emergency room is like. I mean, you're in that emergency room for a while, and it just seems to me that at that time, there could be a spread of the virus.
Sure.
Questions?
Sure. So with that being the way it is, my name is Jason Smith, work with the Center for Emergency Services and cover the emergency management role here at UMC. The screening tool is the very first question we ask them when they present through the door and enter our institution. So once we get their name, if we even get that, we are automatically asking them, have you traveled outside the United States in the past 30 days? Have you had contact with anyone who has traveled? If they answer one of those two questions in the positive, we then look at their signs and symptoms to see if they do fit the criteria for this particular respiratory illness. If they do trigger that, they automatically get a screen prompting them to move the patient immediately to an isolation room after they put a mask on them. So minimizing the exposure to the waiting area or any other possible healthcare individuals or other patients that are currently being seen within the emergency department.
But they will be coming in directly to the emergency room?
It depends. So we also know that known travelers are being brought back into the U.S. and they're being screened upon re-entry, and those, whether they're being held in a quarantine area at one of the facilities that's been established by the government, or they do make it by chance back to Mississippi and considered a low risk, and we're watching them for signs and symptoms of the infection. If we know they're coming, we are and have established a protocol that we could potentially take that patient straight up to a negative pressure isolation room, therefore bypassing the entire ED process. So that is another process that we are working on and potentially looking at with this particular disease.
Are you aware of what's happened at the university?
If we can kind of get to our questions, let's let Dr. Byers speak real quick,
Sure,
and then we'll kind of
absolutely.
get to it, because I know hold on to your question. I know we're going to want them, and it's going to keep going, but I want to kind of do a whole presentation here. So, Dr. Byers, go ahead and speak.
Oh, absolutely. Thank you to the University Medical Center for the opportunity to talk to y'all. You know, this is such a rapidly evolving situation, and you know, we have been aggressively responding to this at the Department of Health for a number of weeks now. You know, part of our response efforts have been to engage our Emergency Operations Center with other agencies, including the University Medical Center, to begin to prepare for the possibility of person-to-person transmission in Mississippi and the United States, and what actions we would take. Some of the actions we're taking right now, obviously, are enhanced surveillance or enhanced monitoring for cases. It's important for us to cast a wide enough net to be able to identify cases that may be in Mississippi, get them tested, get them treated appropriately, get them isolated. So we are working with every hospital in the state we are going to visit every hospital in the state to provide them with guidance about how to identify those individuals that may be at risk, doing a lot of the things that the University Medical Center has talked about already, as far as the ability to triage early, to isolate those individuals immediately under appropriate conditions, and to manage them appropriately with protection for the healthcare personnel as well to limit transmission. I think, one of the things was mentioned about monitoring travelers. We have been engaged in directly, actively monitoring travelers that are coming in from China now for several weeks. As we are aware, the outbreak is expanding to other countries outside of China, and there has been sustained transmission in a number of other countries. But when you look at the cases that are occurring, those individuals who've been in China are still at the highest risk. That's where the majority of the transmission has occurred at this point. We're working closely with CDC to identify those individuals who've traveled to China and to make direct contact with them. One of the things that we're also encouraging anybody who is a traveler to an area where active transmission may be ongoing is to be aware of the symptoms, be aware of the risk, and if that individual develops symptoms consistent with what we're seeing with this, fever, cough, sometimes shortness of breath, we recommend that they call their provider, that they call the emergency department before they arrive. That way that the appropriate infection control can be instituted in place. And we are working with providers and hospitals throughout the state to provide this level of information. We're doing that through multiple different formats that include webinars, that include Health Alert Network messages, information on our website, and direct visits to each hospital. We're also working very hard to develop the capacity to test for COVID-19 at the Mississippi Public Health Lab. This will enhance our surveillance. This gives us the opportunity to expand testing as needed when we identify those individuals who are at risk. We're also, providing a lot of information to businesses, to education, for them to be able to prepare and understand the possibility of person-to-person transmission within the state and what actions they need to take. Dr. Parham also already talked about a number of actions that every Mississippian needs to be taking right now. Even if you're not sick, you need to wash your hands throughout the day, especially after going to the bathroom or before eating, or if you've been around somebody ill. Avoid things like rubbing your eyes or your nose or your mouth, because we know that's how things can be transmitted. Again, please reiterate the thing that if you're ill, you need to stay home. Keep your children home. These are good practices with any infectious disease, including influenza. And we know, and we've reminded Mississippians that we are still in the midst of influenza season right now. We are still seeing widespread transmission throughout the state. If you look at influenza in the United States every year, it leads to hundreds of thousands of hospitalizations. It can lead to as high as 35 to 45 or more thousand deaths in the United States alone. And there are things that we can do to prevent flu. And the best prevention for that is the influenza vaccination. So I encourage everyone, while we're still in the midst of flu season, if you haven't been vaccinated, get vaccinated now. It's not too late. Not only is that your best protection against infection, but it also reduces those complications, hospitalizations, and deaths that we can see from influenza every year. So I urge everybody to take those appropriate precautions.
Questions?
You said that you guys were visiting every hospital in the state. What are you telling these hospitals in the state?
What we're doing is we're providing them with the guidance for how to identify those individuals who may be at risk for COVID-19 based on either exposure to a known or confirmed case, or a healthcare worker who's been directly taking care of an individual who's been infected with COVID-19, or somebody who has traveled. to one of the geographic areas now where we know widespread transmission is going on. That early recognition, that early ability to identify those individuals who may be at risk takes the next step, and that is to isolate those individuals immediately and to care for them with the proper infection control to limit healthcare transmission and limit additional transmission. And then the last step that we are asking hospitals and providers to do is call the Department of Health immediately upon identification of someone who may be at risk for COVID-19. We can provide additional guidance. We now have the ability to provide testing capacity, and we're also providing hospitals and institutions with information and resources from CDC on what sort of things hospitals can be doing to prepare for COVID-19 within the facility and in transmission at large, as well as what type of infection control measures they need to be taken now.
Has the health department made contact with the student at USM?
We know that they've contacted you about the students that have come back from South Korea.
We have worked with the University of Southern Mississippi on the question about a number of travelers who had recently been in South Korea.
They are self-monitoring is what we
Right,
heard.
and that's what's appropriate, and that's what the most current guidance is from CDC. It's important to remember that while South Korea has been established now as a country where there's been widespread transmission, it has not risen to the level that has been seen in China. The current recommendations for individuals who travel to that country is to be aware, number one, to monitor for symptoms that may be indicative of the development of COVID-19, and to reach out to their provider immediately. And we are communicating with the Student Health Center at Southern Mississippi.
Can some people be asymptomatic and then pass it?
You know, I think that there's still a lot to learn about this virus. We know that there have been some reports of potential asymptomatic transmission. I think we are still in the point where we're trying to identify what the full clinical spectrum of this illness is and what the actual transmission looks like. We do know, and CDC feels like, that the vast majority of transmission and the way that this is really being transmitted is through people who are showing signs and symptoms early in the course of that illness when they may be able to transmit that virus to other individuals. So primarily it's going to be from symptomatic individuals, but again, there's still a lot to learn about this virus.
So the student at USM, is that student going to be quarantined?
We're not quarantining anybody.
But you say you guys are in contact with the student center, the student health center.
Yeah, we're working with the students.
So they're not isolated, they're still in the general population?
Are you
even though
talking
they're
about
self-monitoring?
are you talking about a specific
The
student?
choir
or
that came back, the choir visit from USM?
Yeah, there's no recommendations for those individuals to isolate. The recommendations are for those individuals to self-monitor.
So they still allows them to go to class and do everything?
There are no recommendations for those students to isolate.
Is that the safest step? Is that the safest thing they should be doing?
Based on the current expansion of this virus in South Korea, yes, that's the current guidelines.
But they're seeing an increase in South Korea, where we're not seeing that in China, is that correct?
Well, there's been, looks like a decrease in China. It's difficult to interpret the numbers. As we go forth, we'll learn more on that. But according to CDC's current guidance, individuals who have been to South Korea, the recommendation is for those individuals to self-monitor, to be aware of the symptoms, and to report them immediately. And like I said, we are communicating with Southern Mississippi right now.
Is there someone from the health department going to make physical contact with these students?
No, we're not making direct physical contact with each student,
Why not?
because it's not indicated at this point. We've been working with Student Health, who is providing that guidance that we're providing to them.
How does the transmission rate and morbidity rate compare to regular flu?
Well, you know, like I said, there's still a lot to learn about how it's transmitted. Because most of the reported cases have been in individuals with symptomatic or severe infection that have been identified through positive tests. It looks like more than likely that this is going to be transmitted very similar to flu. probably about the same transmission rate as influenza. We know that, for a case of flu, each individual case usually can infect 2 to 3 people who are susceptible around them. It's looking like this virus transmits very similar to flu.
Dr. Myers, but it really is that we don't know a lot about it.
We learn more about it every day. And one of the goals that we've had in working with the CDC is to delay the entrance of this virus into the United States, to have the opportunity to have more time to learn how the virus is being transmitted, have more time to understand who are the people who are at risk, and have more time to develop interventions that can help prevent infection or even treat infection, such as vaccine or antivirals. And that kind of work is ongoing.
So really the advice for the general public is to do just like you would for flu, and that is continue to cleanliness, the hand washing.
Right, and if you do travel abroad to the best intent possible, avoid sick people, right? Stay away from people who are ill, for sure. The only recommendations regarding travel right now that say avoid non-essential travel are directly to South Korea and China. But again, I want to make you understand that although we're starting to see transmission in South Korea, it has not yet risen to the level that it had risen in China. And remember that with China, we were seeing transmission in all parts of the country.
And the CDC did say last night that they confirmed there was a person-to-person transmission in Northern California, and that person had not traveled, and that the people around him had not traveled, supposedly.
Well, what they said was that they had not yet identified an exposure, but they also said that it might be that individual had been exposed to an infected traveler. I think that exposure investigation is still ongoing.
Jason, we hear a lot about the comparisons between coronavirus and the flu, especially flu A. Can you kind of talk to us a little bit about that comparison, mortality rates related to them, how similar, how different?
Sure. So it's a little bit difficult, as Dr. Bowers was indicating, it's a little bit difficult to know really what the mortality of COVID-19 is right now. Best estimates now is that it's around 2% based on the cases that they're seeing inside China. It's always difficult to know a couple of years from now if that's really going to be the mortality rate that we're reporting, because a lot of cases are very sick patients that have been in the hospital. We don't really know how many folks have been infected and then didn't get care, or were not tested or were not diagnosed and then later got better and weren't counted in the overall numbers. So it's a little bit hard to know what the total, we know what the numerator is because we know how many people died. We don't necessarily know what the denominator is. So 2% is about what they're thinking right now, but that could always go up or down depending on how we're able to look back and how we're able to get some of those less symptomatic patients counted as being infected with COVID-19. Flu mortality for seasonal flu influenza is somewhere around 0.1%, so this is potentially 20 times as fatal based on the early numbers, but that, again, that's highly dependent. We have lots of patients that die every year from influenza. Patients that are most at risk are ones that have comorbidities, other health problems, and that seems to be a similar situation for COVID-19. Patients, people that have other health problems are at higher risk.
That does lead me to another question. You mentioned some people that have other morbidity, other issues.
Mm-hmm.
Who else is at, who would be at escalated risk for this disease?
Again, it's still early, so it's really hard to know for sure, but thus far, individuals that had other serious health problems, including things like severe diabetes or uncontrolled diabetes, lung problems, obviously people with COPD or emphysema or underlying lung disease, folks that are immunocompromised because they have cancer or on chemotherapy, those would be some of the folks that we would be most concerned about. And then, of course, folks at either end of the spectrum, the very young or the older patients. So we certainly know that we do appear to have higher mortality rates from the numbers reported out of China in folks that are older.
Any other questions about how, for instance, the medical center, an example of a hospital is preparing for this? Any other questions?
If y'all do have somebody that approaches you and says, I believe that I might have been in contact with somebody who traveled recently and I want to be tested, what process should they go through?
We'd like to have
So, if there is a case who's suspected, so we will follow the definitions which are given by CDC. So they are very specific. The case should have signs and symptoms, which is fever, cough, or shortness of breath, and they should have had travel to mainland China or specifically Wuhan in some cases, and as well contact with a confirmed laboratory confirmed case of COVID-19. So there will be some concerns from a traveler saying that they were around someone and they don't know for sure if that person had COVID-19. But at this point, the main people who are under investigation or should be considered to be under investigation are those who have had lab confirmed COVID-19. So if the person was in close contact, and this means that they should be within the 3-feet distance with that person who was actively symptomatic and had confirmed case. In that case, we have informed them that they need to call ahead to their primary care doctor or to the emergency department, so that that primary care doctor's office or the institute can be prepared to receive the patient. We have provided instructions that they would be provided specific guidance on how to come to the hospital or when to come to the hospital or a clinic facility, so that there will be less exposure of the staff as well as any other people who are in the waiting area.
And if I can add too, you know, if a healthcare provider or hospital gets presented with a situation where they're not certain if that individual needs to be fully evaluated or tested for COVID-19, really what we encourage them to do is call the Department of Health, and we can work together to determine, based on the situation, whether or not testing is indicated.
Anything else? Okay, thanks y'all for coming.
Thank you.
Thanks, guys. Thank you.
Sorry.